Madam Chairwoman, let me thank you again for convening this hearing to call attention to the intrusive restrictions that are threatening the health and well-being of thousands of women in my congressional district and home state. In Missouri, we're down to one last abortion clinic. State health officials are doing everything in their power to try to shut that clinic down. They are trying to regulate Missouri's last clinic out of existence by imposing rules and regulations that are medically unnecessary, overtly intrusive, or virtually impossible for any healthcare provider to comply with. And as you heard Dr. McNicholas explain, the health department began enforcing a medically unnecessary requirement that women submit to an additional pelvic exam 3 days before being allowed to have an abortion. Dr. McNicholas, as a physician, is there any medical reason for such a requirement?
Thank you for the question, Representative Clay. So as I previously stated, and I think you noted as well, forcing women to undergo medically unnecessary pelvic exams shows clear disregard for the potential traumatic impact that has. We're talking about a country where every 73 seconds an American is victimized with sexual assault, and that rate is 12 times higher for women with intellectual disabilities. Within days of having to comply with that mandate, we saw a patient, a minor, accompanied by her mom, who was a victim of sexual assault, who had never had a pelvic exam before, who didn't even know what her parts were. And as a reminder for those of you who have never had a pelvic exam in this room, that means putting your fingers inside someone's vagina, forcing somebody, this minor, never having had a pelvic exam, to have that invasive procedure when there was absolutely no medically relevant reason to do so was traumatic for her mother, and for the physician who was required to do it.
How did that make you and your staff feel?
So I can tell you that in the times when we had to comply with this regulation, I'm not sure who cried more, the physicians, the staff, the patients. We had patients apologizing to us that we were forced to do this to them. Our patients are accustomed to jumping through hoop after hoop to get an abortion. So when told they had to do this too, they were resigned to the fact that that was just part of the deal. But it was traumatic for everyone.
And if that wasn't outrageous enough, just weeks ago we learned that the state staff were ordered to keep a spreadsheet tracking the menstrual cycles of women who visited St. Louis's Planned Parenthood clinic. Doctor, do you find the practice of tracking the dates of patients' periods problematic?
I find it bizarre and a complete violation of the trust that the community puts in the public health department and the trust that our patients put in us. It was clearly part of an orchestrated attack on Planned Parenthood and really demonstrates an abuse of power and misuse of data.
And what do you make of the fact that a trained physician has imposed these medically unnecessary and intrusive requirements on providers and patients?
So it's shocking that our Department of Health is headed by a physician, Dr. Randall Williams, and more shocking is that he is an OBGYN. He knows better, but instead of relying on the medical ethics that he was taught and the many patient experiences that he's had over the course of his career, he instead decided that his job was to act at the behest of a politician to end abortion as part of a political agenda and forgetting what it's like to treat patients.
What would it mean for patients in Missouri if your clinic closes?
You know, the consequence of that is there are so many consequences to that. Certainly, people will be forced to carry pregnancies that they can't and shouldn't and don't want to, continuing the cycle of poverty for some. Many will be forced to travel long distances, expending resources they already don't have to access that care. And people will have really lost the trust that they have in the state of Missouri, who would then have abdicated its responsibility to providing very basic health care.
I thank you for your response, and I thank the entire panel for being here today. And Madam Chair, I yield back.